when I was trying to help my patients to make changes in their life, make a change, the first thing they'll say, but doc, I have no energy to make those changes. I'm so addicted to this pattern of eating or this pattern of living or this pattern of my lifestyle. I cannot make changes. So as a cardiologist, I felt helpless that how am I going to make my patient make these changes? Because I'm asking you to change your diet. I'm asking you to do intermittent fasting. I'm asking you to exercise more. I'm asking you to sleep more. I'm asking you to change your routines in your daytime. I'm asking you to change your routines in the evening. I'm asking you to change your habits when it comes to gadgets and even lighting. There's so many things I'm asking you to do. But the problem is that most people cannot make the changes. You're stuck. You're addicted. You're stuck in this lifestyle. And how do you harness the energy to make a change? Changing is not easy. And my answer in all the years that I've been dealing with patients comes down to this one technique, which I'm going to hopefully pass on to you today, and that is silence. Because it is through silence that you will actually harness the techniques, the methodologies, and the energy to make all these changes that we really need to make, because it's not easy to make changes. We are creatures of habits. Let's admit it. We are creatures of habits. We got here today because of the habits. Now you're asking me to change my habit? And you're not giving me any tools to make changes? Well, hopefully I can give you some tools today. So what I decided to do for myself was a technique that I use to this date, where I sit down quietly in silence. And I close my eyes and just sit. No agenda whatsoever. I'm just sitting. What are you doing, doc? I'm just sitting. And I close my eyes and I concentrate on my breath going in and out through my nose. And then I can feel the breath coming in and the breath going out. And initially, myself and some people around me thought, what a waste of time. But then I started noticing that thoughts come into my head. I got to take the laundry out. I forgot to do that. And then I follow up on that. But suddenly I say, no, I'm not following up on that thought because I did not invite the laundry list. I did not. So I come back to my nose. And I put my attention on my nose. Whose attention is it? It's my attention. I decided to concentrate on my nose and my breath. So I take my attention away from my thought of the laundry and I come back to my nose. And I'm aware now of the breath coming in and out, and that's all I'm aware of. And then about 10 seconds later, another thought comes that your car needed servicing and you still didn't take it in. Now, wait a second, I didn't invite that. That is true, I do need to take my car in. But that's not a thought I need to entertain right now. It is a thought, but I want to think about it on my terms. So again, I don't follow up on it. I come back to my breathing. Because if I followed up on it, next thing I'll be taking out my iPhone and I'll be looking at my schedule to see when the car needs to go in. And right now, I don't want to do that. I want to come back to put my attention on my nose and on my breath. And I keep doing this for every thought that comes. And guess what? It was the toughest thing I had to ever conquer. It was very difficult to do. Because the instinct is to get up and do something. Stop wasting your time sitting around. But your ability to pull your thoughts and put them away and take your attention and draw it back to your nose, that ability is your muscle strength. Your muscle work is going to be to pull your attention and your awareness away from those thoughts and put it where you want to do it. That's the muscle that you need to develop. So now I will entertain the thoughts that I want to entertain. When, how, under my conditions. And I found out that when I was able to do this and take away my awareness from those thoughts and put them where I want to put them at that time, made my day-to-day life better. Because then when I'm with patients, or if I'm doing surgery or something, I can just do what I want to do at that moment. And those intrusive thoughts I don't have to entertain them. And even if they do come, I'm quickly able to come back to what I'm doing now because I did this exercise. So I only did 10 minutes of it. First, I did 5 minutes for about 3-4 months, then about 10 minutes. And nowadays, I don't do more than 10 minutes of this, but I do it in the morning and I do it in the evening. And some people do it longer periods of time. Absolutely. There were times when I've done it for even longer. And when I first did it, I'm going to share something with you all. When I first did it, I did a silence retreat for 10 days. And that was probably the toughest thing I've ever done. Now, I'm not advising you all to do it, but start this at home. Start it at home. Find your little corner. Sit down. Don't sit in an awkward position. You don't have to be cross-legged or anything, because then you're aware of my pain in my knees, pain in my butt, pain in my back. No, just find a comfortable position. You can even do it lying down if you want. Trouble is that you tend to fall asleep if you're lying down. So I just like to sit in a nice, comfortable chair, and I'm not aware of my bodily sensations because I don't want thoughts, because those bodily sensations are thoughts as well. Oh, I've got an aching knee. Oh, I got a little neck ache here. Oh, I got an itch over here. They're all thoughts. They're all thoughts. Everything is thoughts. All your emotions are thoughts. All these sensations are all thoughts. So you want to kind of be sensation-free so that you can get into this silence. You have to get into the silence. Then you can put your attention to your nose and your breathing, and then you'll see those thoughts coming into your consciousness. They are like logs on a stream, and they just float by, but you let them float and go away. And then there's the silence. Then another log comes, and then there's a silence. Another log comes by, there's a silence. And eventually, you'll be in longer and longer periods of silence. So let me explain to you typical scenarios for patients. You have to cut out carbohydrates. You got to cut out all sugars. All the sweets that you are eating right now, you need to get rid of all those. And the poor patient says, but doc, I'm addicted. It's my life. I've done it for so many years. Now, if they've done this exercise, the power of the silence to make you survive, once they've done this, now when the thought comes that I got to eat the sweet, they'll say, that's a thought. It's all thoughts. Whether you're clinging to something and you're getting withdrawal from sweets, they're all thoughts. All you need to do then is think about this exercise. I am registering the thought of hunger, or I'm registering the thought of eating the sugar. I'm registering the thought of eating the carbohydrates. But I don't have to do it. I'm going to put my attention somewhere else right now. And you take your attention, put it away from the sweets, and put it into something else. So you may want to go read your book, or go out into the garden, or do something different. In the past, you wouldn't. You'd give in to that, because you take possession of the thought and you say, indeed, I am hungry. Indeed, I am somebody that needs sweets. Now you realize that there's you and the thought of having the sweet. You don't have to have that sweet. And that ability to pull away from that is the exercise that you're doing in silence. You will pull away from that wish to eat. Same thing for, let's say, fasting. I got to eat because it's 12 o'clock. I told you all that you become a Pavlovian dog because the bell rings and you're salivating. So it's 12 o'clock, you got to go eat. You're not really hungry, but the thought comes to you that it's 12 o'clock, I got to go eat. Now, because you've done this exercise, you can walk away from that. You can say, I'm going to put my attention on something else. I'm going to actually take a little walk around the outside and get some red light therapy coming out from the sun. And it's not just red light, it's going to give me the broad spectrum. And I'm going to get some UV light as well. And I'm going to get red light therapy. And I'm going to get fresh air outside. I'm going to get some biophilia outside. You're going to do something different. But now that's a decision you made, not a decision that was imposed on you. Get out of this life of imposition. You are free beings. And when they say you are free thinkers, I take it beyond that. No. Yes, you are a free thinker, but you're a free consciousness, free to entertain whatever you want to entertain. So the other things that I noticed is that when patients do this, their blood pressures come down. What? How did the blood pressure come down? Because when you go into silence, these thoughts are not there. Bad emotions, bad thoughts, stressful thoughts affect your biology. So we've always said that, how do thoughts affect my biology? How can it make my blood pressure go up? Well, we know it's true. And now we know the pathways as well. It's all to do with the mitochondria. It affects your mitochondria. And you're going to make more redox oxygen potentials, and you get more inflammation, you get epigenetic changes, you get adrenaline coming in, you get cortisol coming in, you get dopamine also participating. All your bad thoughts, your emotional thoughts, all negativities will result in a biological change in your body. I don't want that chemistry to change. But when I am in my amness, when I'm just in my consciousness, I've turned off all those chemicals. And the effect lasts for the whole day, or at least 12 hours that we know of. And then you do it again. So you're constantly getting this reset of your hormones. Then obviously the blood pressure is going to go down. Look, you've all been told that you have high blood pressure. Here's a pill. You got to take it forever. And you all know that I've said this over and over again, that there's no such thing as essential hypertension. You've got to get the root cause of it, which may be insulin resistance or sleep apnea or stress. Your lifestyle, circadian pattern disorders, toxicity, lots of reasons for high blood pressure, but we need to get to the root cause of it. But one of them is actually this, that don't think that your thoughts don't translate into your physiology. Your thoughts metabolize themselves into the chemicals of your body. In your thoughts, you get sympathetic activity all the time. In silence, you get parasympathetic. Sympathetic, parasympathetic. You want to enhance your parasympathetic, you need to go into silence. You want to constantly entertain thoughts, you're going to get lots of sympathetic, fight, flight, flight, adrenaline, all day long. And then, welcome to modern diseases. You want vagal tones. You get vagal tones through this breathing exercise and letting full control of your thoughts. Go into emptiness, go into silence, and you'll get a burst of parasympathetic into your body. Pulse rate goes down. That's why I like this one technique, which is the breathing technique. Breathing into the count of 4, breathing out to the count of 8. When you're doing that, at the same time as you do this silence, you're also stimulating your parasympathetic nerve, because it's expiration that stimulates parasympathetic. Inspiration stimulates sympathetic. That's why when you are all excited and stressed out, your breath is up there, because you're stimulating that sympathetic nerve endings in your chest. But parasympathetic, you're breathing out, long expiration. Now you're stimulating all the parasympathetic vagal nerves in your body. So there is no negative part of this entire technique, and it's simple, folks, it's simple. Shut the monkey up in your head. Realize that that's not you. Those are just thoughts, and thoughts pop up from your subconscious. You didn't invite them into your consciousness. There's two parts of you. There's your consciousness, your subconscious. You are in charge. Your consciousness is in charge. You should be constantly aware of this fact that there's two of you, and don't take possession of those thoughts. You can entertain thoughts on your terms. Go into silence. Nobody teaches us that. Nobody taught me that. With my background growing up, nobody taught me. Nobody told me to sit down and just be quiet. When they did, it was because I was mischievous. Hey, sit down and be quiet as a child. But no, I'm in quiet. I learned it the hard way, and I'm passing it on to all of you now. And the patients of mine that have embraced this, I can't tell you what they've done. They've lost 50 pounds, they've lost 100 pounds, they've fasted for up to 180 days. And I'm like, how did you do this? There's a doc, you made it happen. They were able to get over addictions. They were able to exercise now. They were able to mend relationships. and they come into the office laughing, smiling, and being happy. But I can't sit down with everybody and talk about this individually. So I hope that this video has helped you, because you can look at it, listen to it, and do it yourself, experience it. Don't just listen to this at an intellectual level. Do it, experience it, feel it. Everything has to be experiential, otherwise it's just mental again. And I'm telling you to be less mental and more experiential. So if you really liked and enjoyed this video, then check out this clip, because I think you'll find it very helpful. And of course, if you want to see the full video, this is where you'd go. Now, also, don't forget to check out my website, because there's lots of educational materials and resources there. You'll also find how to contact me or have a consultation with me. So please do check out my website. Thank you.